Okay, so you're here because you want to get a handle on menopause. You want to know what it is, like what it really means, and how to like deal with it,
Definitely.
right? And we know there's a lot of info out there. It's hard to sift through it all. So
Can be.
we've gone ahead and done the digging for you.
Yes, we have.
We've got this really thorough guide from Healthline. It's their like complete guide to menopause.
Mm-hmm.
And today we're going to like pull out those crucial bits, the stuff that'll really give you a good understanding and make you feel a lot more in control.
Yeah, exactly.
Okay, so let's just jump right in. Menopause. When we say that, what exactly are we talking about? Like biologically, what's going on?
So basically, it's like the official end of your reproductive years,
Yeah.
and the signal is when you haven't had a period for 12 months straight,
Yeah.
like a full year.
Okay, so that's the like the marker,
Yeah.
12 months, no period.
Yeah, the biological indicator.
Okay. And what kind of like sets this whole change in motion? What's happening?
So actually a gradual process, and it's driven by, declining hormone levels,
Okay.
particularly estrogen and progesterone. And this is all happening as your ovaries, which house those reproductive follicles,
Mm-hmm.
become less active and eventually stop releasing eggs.
Okay, so it's like this dwindling of the follicles that leads to lower hormone levels, which means no more ovulation,
Exactly.
which means no more periods and you can't get pregnant.
That's exactly it.
Yeah.
And on average, in the U.S., this happens around age 51.
51, okay. So there's this whole period leading up to that 12-month mark, though, right?
Right.
It's not like you just suddenly hit menopause.
No.
There's this transition phase.
Yeah.
You hear the term perimenopause thrown around a lot.
Yeah, it's that lead-in time
Okay.
to menopause.
Mm-hmm.
And it typically starts in your mid-40s.
Okay.
But what's really interesting is the duration can vary so much.
Oh, really?
Yeah, on average, it's between 7 and 14 years.
Wow. Okay.
But for some people, it could be just a few months, or it could go on for years.
Wow. So that's a pretty big range.
Yeah. Okay, so what's happening during perimenopause?
Your hormone levels are fluctuating.
Okay.
So they're going up and down.
Oh, so it's not even just like a steady decline. It's like,
No, it's not a straight line.
okay,
It's up and down, kind of erratically.
got it.
And that's what causes your periods to change. So you might notice they get heavier or lighter or less frequent.
So if your period's acting up, that's like one sign you might be in perimenopause.
It could be, yeah.
Okay, and then once you hit that year without a period, that's when it's like, okay, this is it.
That's menopause. Yeah.
You're menopause. Now, what happens after you reach menopause? Like, do things settle down, or is it still a bit of a roller coaster?
Well, once you've gone 12 months without a period, you're officially in menopause.
Okay.
Now, some of those symptoms that might have started during perimenopause, like hot flashes,
Yeah.
those can continue even after you reach menopause.
Oh, really? I thought once you hit menopause, it was smooth sailing.
It would be nice, but not always.
Yeah, okay, so the hot flashes can stick around.
What about after menopause? Like, are we done with the hormonal shifts at that point?
It doesn't quite end there. The years after menopause are called postmenopause.
Okay.
And for most people, symptoms do start to ease up.
Okay, good.
But because of the lower estrogen, you're at a higher risk for some health conditions, like osteoporosis.
Okay, so important to keep that in mind.
Definitely.
The guide also mentioned early and premature menopause. What's the difference?
So early menopause is when it happens between 40 and 45.
Okay.
Premature is even earlier, before 40.
Before 40, wow. Are there things that can cause that?
Yeah, several things can make menopause come sooner,
Okay.
like medical treatments, like chemotherapy,
Right.
certain types of gender-affirming hormone therapy,
Okay.
also physical things like a pelvic injury, radiation therapy, or if you have your ovaries surgically removed.
Okay, so lots of different factors can play into it.
Right.
All right, so we have a pretty good grasp on like what menopause is, the different stages. Let's talk symptoms, because I think that's what's on everyone's mind.
Of course.
The guide lists a lot.
It does.
And I think the important thing to remember here is that,
Every woman's experience is different.
exactly.
The type, intensity, how long they last,
Oh.
it varies so much from person to person.
Yeah, some people sail through it, others have a really tough time.
Exactly.
Let's start with the physical symptoms, because I think hot flashes are probably top of mind for most
Yeah,
people.
definitely. Those sudden waves of heat
Yeah,
that just spread through your body, those are super common. But it's not just hot flashes.
right.
The guide mentions potential changes in your breasts, like size or shape,
Mm-hmm.
dry eyes,
Mm-hmm.
flushing,
Mhm.
even hair loss. You might get more headaches. And some women report an increase in facial or body hair that's called hirsutism.
Hirsutism. Okay,
Yeah.
so that's something to be aware of.
Yeah. And you could also notice your heart rate going up, unexpectedly, like palpitations.
Wow, okay. So a lot of things going on.
Yeah, and the list keeps going. Increased urination,
Oh, yeah.
trouble sleeping, insomnia.
Ugh, that's the worst.
It can be. Itching
Wow.
muscle and joint pain that seemingly come out of nowhere. Then there's night sweats, which are basically hot flashes that happen when you're trying to sleep.
Oh, so you wake up like drenched.
Yeah, exactly.
That sounds awful. So basically, you're not getting any sleep.
It can be really disruptive.
Okay, so we've got all that, and it doesn't stop there, right?
No, there's more. Pain during sex, which is called dyspareunia, often linked to vaginal dryness,
Okay.
breast tenderness or soreness,
Mm-hmm.
vulvovaginal atrophy, which can also lead to that dryness, and weight gain.
Wow, that's a lot to deal with.
It can be.
So it sounds like the physical changes are pretty huge, and they affect so many areas of your life.
Right, and it's not just physical.
Right. You got the mental and emotional stuff, too.
Exactly. Those hormonal shifts can really mess with your mental and emotional state.
Yeah, I can imagine.
Common things are increased anxiety,
Oh, okay.
decreased sexual desire or libido, feelings of depression, difficulty concentrating, that brain fog people talk about,
Oh, yeah, the brain.
irritability, constant fatigue,
Right.
forgetfulness, and mood swings.
Wow, it really is like a whole body experience, isn't it?
It really is.
And to make matters worse, the guy also says menopause can increase the risk of other health problems?
It's true, mainly because of the lower estrogen, you're more likely to develop certain conditions.
Okay, like what?
Heart disease,
Hmm.
osteoporosis that weakens your bones,
Right.
urinary incontinence, which is, leaks,
Yeah.
UTIs, and vaginal infections.
Okay, so it's not just about managing the symptoms of menopause. It's also about being aware of these potential longer-term health risks.
Exactly.
Okay, so with all these changes happening, how do you even know if what you're experiencing is menopause? Like, when should you go see a doctor?
It's always a good idea to talk to your doctor if you're having new or unusual symptoms,
Okay.
especially if they're really affecting your life.
Right.
They can help figure out what's going on and rule out other causes.
Are there specific tests they can do to, like, confirm if it's menopause?
Yes, they can do blood tests to measure your hormone levels.
Okay.
One test they mentioned is the pico-AMH ELISA, which can tell you about your ovarian reserve.
Okay.
More commonly, though, they'll check your FSH, which is follicle-stimulating hormone, and estradiol.
Got it.
If your FSH is consistently high, like 30 MIU/mL or higher, and you haven't had a period for a year, that usually confirms menopause.
Okay, that makes sense. And they might do other blood work too, right?
Yeah, depending on your symptoms and medical history,
Okay.
they might want to rule out other conditions that could be causing similar problems. So they might check things like your cholesterol, estradiol itself, HCG to make sure you're not pregnant, kidney and liver function, progesterone, prolactin, testosterone, thyroid function.
Wow, so it's a pretty thorough workup.
Yeah, they want to get a complete picture.
Okay, so you get the diagnosis now. How do you deal with all of this? The guide talks about both like medical treatments and things you can do yourself, right?
Yeah, and the important thing is to work with your doctor to create a plan that's specific to you.
Okay,
Because what works for one person might not work for another.
of course. So what are some of the medical treatments that are out there?
Well, for hot flashes, your doctor might prescribe certain antidepressants
Okay.
or other oral medications that can help.
Mm-hmm.
If you're dealing with vaginal dryness and discomfort from atrophic vaginitis, topical hormone therapy can be really effective.
Okay.
For everyday dryness, you can use vaginal moisturizers.
Okay.
And for discomfort during sex, there are lubricants.
So there are options. And what about things you can do at home, like lifestyle changes?
Yeah, there's a lot you can do on your own.
Like what?
For personal care, using a daily moisturizer helps with dry skin.
Okay.
Choose mild soaps and protect your skin from the sun. That can make dryness worse.
Right.
Dressing in layers and having a little fan handy can be lifesavers for hot flashes.
Good tips. What about diet and exercise?
Those are key for overall health during this time. A balanced diet with plenty of nutrients is crucial.
Okay.
If you're not sure you're getting enough of specific vitamins or minerals, talk to your doctor about supplements.
Okay.
Some research suggests omega-3 fatty acids might help with night sweats.
Okay.
And you want to make sure you're getting enough calcium, vitamin D, and magnesium for bone health and to help prevent osteoporosis.
So important.
As for exercise, aim for at least 150 minutes of moderate exercise per week,
Okay.
plus 2 sessions of strength training.
Strength training, all right.
It'll help with energy levels, mood, bone health, and weight management.
Okay, so basically move your body, eat well,
Yep.
and don't forget about your mental and emotional health.
That's so important. Things like yoga and meditation can be super helpful for stress.
Okay.
Learn some breathing techniques like box breathing.
Mm-hmm.
It can really help when you're feeling anxious or overwhelmed.
Right.
Support groups and therapy can also be incredibly valuable for emotional support.
It's good to have that outlet. Are there any habits to be careful of during this time?
Yeah, the guide talks about substance use. If you smoke, try to quit. It's
Right.
best for your overall health. Avoid secondhand smoke, too.
Mm-hmm.
And alcohol can sometimes worsen symptoms for some people, so try to limit yourself to 1 drink per day at most.
Okay, good advice. What about alternative remedies? You hear a lot about those for menopause.
Yeah, the guide mentions a few. Black cohosh is sometimes used for hot flashes and night sweats,
Okay.
but the scientific evidence for it is still limited.
Right.
They need to do more research.
Got it.
Other remedies, like soy isoflavones, melatonin, and flaxseed, have been suggested to affect estrogen levels.
Mm-hmm.
But there's not enough evidence to say for sure if they're safe or effective.
So it's kind of like proceed with caution.
Yeah, talk to your doctor before trying anything.
Okay, good advice. So let's do a quick recap. What are the key takeaways here?
Okay, so menopause is a totally natural process.
Right.
It marks the end of your reproductive years. It happens in stages: perimenopause, menopause, and postmenopause.
Right.
And each stage can bring different experiences.
Okay.
The symptoms can be all over the place,
Yeah.
affecting you physically, mentally, and emotionally.
That's a lot.
It is, but there are things that can help, both medical treatments and lifestyle changes.
Okay.
And most importantly, talk to your doctor.
Yes. Always good advice.
They can help you figure out what's going on and come up with a plan that works for you.
Perfect. Well, that was a super informative deep dive into Healthline's guide.
I hope so.
I feel like we covered a lot.
We did.
Hopefully you now have a much clearer understanding of menopause, the stages, the symptoms, and the ways you can manage it all.
Definitely. I hope this was helpful.
And as a final thought, think
Mhm.
about this. Menopause affects so many parts of your life. What area do you think would be most beneficial for you to learn more about?
That's a great question.
Maybe do some research on your own or talk to your doctor in more detail about it.
Yeah.
It's a big life change.
It is.
And being proactive about understanding it can make a huge difference.
Absolutely.
So that's it for today's deep dive. We'll see you next time.
Thanks for listening.